The perfect remedy for the imperfect ear. The Earwell is a novel and landmark product that non-surgically corrects virtually all ear deformities in newborns. It boasts a success rate that approaches 99%, is simple to apply. A deformity of any kind represents a calamity to the parents of newborns, and facial deformities magnify the horror. Infant ear deformities represent the most common of all facial deformities and typically require years of waiting until the child matures enough for doctors to surgically correct the problem. The Earwell eliminates those years of embarrassment for the child and anxiety for the parents.
We heard the alternative was a surgery, but she'd have to wait till she's a little bit older, 3, 4 years old, and then it would actually be really painful, and have her have stitches, and little kids going to be pulling at them, itching. It just sounded like a nightmare. So we were very excited to hear that we had an opportunity to do something that was going to be, one, painless, and also done before she could ever remember or have bad memories with it. So
the Earwell can be applied to any infant's ear that exhibits a deformity or malformation immediately after birth. Within weeks, the ear will be perfectly shaped, and the parents will be relieved and grateful. The physician will have invested minimal procedural time.
And I think that, of course, is a huge benefit to both the pediatrician and to the families who are undergoing this procedure.
The Earwell is unique because it's a device that essentially incorporates what's needed behind the ear to force the cartilage to bend into a predictable shape.
Various studies conducted at the Baylor University Medical Center reveal that the incidence of infant ear deformities ranges from 15 to 29% of all births. This translates to a domestic patient base of between 800,000 and 1.5 million infants per year. Some of those deformities self-correct, some do not, and some get worse. A Japanese longitudinal study reveals that it is impossible to anticipate which course the deformed ear will take. We believe the Earwell provides the most logical choice to parents facing such a decision.
It's an amazing thing that these kids, babies, will have circulating estrogens that will maintain the ear's soft and supple character. And so it's very easy to mold. And with a device like this, you can quite simply reshape the ear over a period of 1 to 2 months while the cartilage hardens in the desired shape.
The Earwell will give us a predictable aesthetic outcome in the shortest period of time that is possible.
The procedure can be easily learned, quickly completed, and conducted within a standard exam room and does not need an anesthesiologist.
This process looks much less complicated, something that I feel that would be easy for me to do in my office.
The Earwell is the rare product that can immediately satisfy the needs and wants of children, parents, and physicians. The Earwell corrects ear deformities in children, provides anxiety relief for parents.
The thing that I would really advise or recommend would be to follow your instincts. If it's something that you think will bother them or bother you later on, it's so much easier to take care of it when they're so little and they don't care.
And we look at our experience as a blessing for our son, and it's been great. His ears are perfect.